Welcome to Behind the ABA Talk podcast, where we have heart-to-heart conversations with expert speakers from the LSGurdin Consulting Continuing Education program. I'm your host, Lisa Gurdin, founder of LSGurdin Consulting. A special thank you to our CE partners and sponsors, Massachusetts Partnership for Youth, Lab Collaborative, Accept Collaborative, and QBS Safety Care is sponsoring this month's talk. Our amazing guest is Dr. Rebecca Markovits, who will be our expert presenter for the LSGurdin Consulting monthly program on February 6th. Dr. Markovits will be talking about the importance of understanding complex behavior and how comorbidities affect the development of behavior change programs. She has her doctoral degree in behavior analysis from Simmons University and spent many years as a clinician and assistant clinical director at a school and residential program for students up to age 22 with developmental, mental, and behavioral diagnoses. Dr. Markovits is currently an associate teaching professor at the University of Massachusetts Lowell. Her academic focus is on the clinical and practical development of students in the psychology department's undergraduate and graduate programs in behavior analysis. She hopes her students gain an appreciation of how wonderfully complex behavior is and the need to consider environmental and biological factors as well as private events in our understanding of behavior, and I love that so much. Welcome, Becky. So happy you are here to talk about this really important topic.
I'm so glad to be here. I love talking about this, so I'm very excited.
Amazing. Well, this is a lot of the work that I do is with complex behaviors, and so I'm so excited to explore on a deeper level what it all means and how we should think about these behaviors and think about the profiles of the individuals that we serve. I want to ask you why you talk about wonderfully complex behavior. You use the word wonderfully. Why? Why? I mean, I think that as well, but why do you think about it as wonderfully complex?
I think about it as wonderfully complex because there are so many different variables that affect from the most subtle behaviors all the way to kind of these really large repertoires. And as amazing as we are at understanding behavior and analyzing the environment, there's still a lot that we don't know about behavior, and a lot of that is because we just don't have access to observing and measuring a lot of those things. And so I just feel that it's so fascinating, and the fact that we still have a long way to go in completely understanding human behavior, especially for people with language, with thoughts and feelings and emotions. We're still kind of at the beginning of that, I think, and for me, taking that into consideration when we're studying human behavior is, I just find it so fascinating.
Yes, I agree. I agree. And, being a behavior analyst, for me, for multiple decades and just watching the evolution of our understanding of behavior
Mhm.
over those, multiple decades, we have come a long way. We now have, more paradigms that we can use to explain behavior
Right.
and understand behavior. But I agree, there's definitely, we have, a ways to go. So can you share your professional journey? Like how did you get here?
Um, so I sort of fell into it at the beginning as an undergrad, and I've been here ever since. When I was an undergrad at Binghamton University, um, one of the things that one of my professors was talking about is that if you want to go to grad school, if you want to call yourself a psychologist, when you're in your undergrad, you need to do something other than just going to classes. You need to get experience, whether it's research, whether it's working somewhere or volunteering. And my undergrad program had two tracks within the psych department. One was in biopsychology, and the other one was in applied behavior analysis. And I first looked at the biopsychology one, and then I saw I had to take things like chemistry and advanced biology. And I was like, well, that's not for me. So I went to this kind of open meeting for the behavior analysis track because on the campus of our school, we actually had a school for individuals who needed educational services. And I went there and I thought I was just going to see what it was all about. And apparently it was just signing yourself up. And so then they're like, okay, here's your training date. And I was like, okay, I guess I'm doing this. So I went to the training date. I think I was a sophomore in college. Got my training, and then I spent the next 3 years there as a student um, behavior tech. That's not what we called them back then, but that's what it was. And then I became a student supervisor, and then I was helping the doc students with their research and being a research assistant. And then it just kind of grew from there.
Amazing. Amazing. So when you think about what what drew you originally and what helps you to sort of stay in the field, what's your why? Like what is it?
So the real thing that clicked for me was I was working at first when I first started at that center, I was working with preschool aged and like kindergarten aged students. Um, and the classroom that I was in had primarily nonverbal children in it. And I remember working on all of these programs, especially around communication. And then it was the university spring break. So I went off just for spring break, came back, like a week or so later, and the nonverbal student that I had been working with was starting to talk and starting to, say say words, and we were starting to be able to understand him. And one of the teachers of the classroom came up to me and she's like, you helped with this, right? This was we He's doing this because you've been working with him on this for so long. And I guess it never had clicked with me until that point, because it can take so long to see the behavior change and the results of all the work that you put into it. But actually being able to see the results, and helping this child to learn to communicate, which is such an important skill, I just fell in love, and I wanted to do everything I could to stay and learn in the field.
Amazing. So working with individuals with complex behaviors, particularly in specialized settings,
Mhm.
um, is a lot, and it's
It is.
hard, and there are really challenging days. So if have, do you have recommendations, based on your own experience of how you get through those days and how you build resilience so you don't get burnt out? Or if you
Right.
do, how do you get back to it?
Yeah. It's definitely difficult. Um, the setting where I worked, it was the last stop before these individuals needed hospitalization, essentially. And so it wasn't just the students that needed extra help that a school district couldn't provide. So one of the most important things is having a supportive work environment and supportive team members. If you are working with people that you don't trust, or you're working with people who are causing drama, and because there are days where you are not going to want to go to work, but having that supportive environment, having whoever is running the program director, whoever, understanding the population that you're working with and the stress that the staff are under, then you're not going to be able to do it. But if you have people who you work with that understand the job, are able to support it, it makes that job a lot easier, because you're going to find yourself in situations that you couldn't have even dreamt of. And if you know that you have people at your back that are going to help you, that is super important. Um, and I think the other important thing is understanding your own limitations. Sometimes I see people who are working with a client and, excuse me, they just want to see it through. And sometimes that's not the best path to take. Um, if you are getting frustrated, you're not going into implementing that intervention in kind of the neutral way that you might need to, or kind of separating yourself from what that individual is doing at that time. Um, I think it's fine to take a break, to switch out with somebody, because it's not going to do you or that individual any good if both of you are just continuing this cycle of frustration. Um, I know a lot of people are like, well, we got to keep at it because otherwise we might reinforce this behavior by getting rid of this person. Um, and it could be true, but the number of times that might need to happen before it's actually built up into something that is going to happen time and time again, switching out a couple times and knowing your limits is not a bad thing.
Yeah, absolutely. I think when you think about the two options, I stay in it and get frustrated and start reacting emotionally
Mhm.
and not really being able to implement the intervention, with integrity versus tapping out, having someone do that
Right.
with integrity, right? And then really, usually the whole episode is much shorter,
Yeah,
right? And so how do you I think that's really hard for people to tap it out, right? And to say,
it
I'm
is.
not being successful. Like, how do you deal with the guilt of that or the feeling like, you weren't worthy of so you stepped out, even though what we're saying is that's actually a really important strategy to use. But I don't know that everybody takes it that way.
It's definitely difficult because it's always difficult to realize that you have a limitation in any
Yes.
area.
Yes.
Understanding where we need growth or where we're not necessarily doing as well as we want to be doing, it's a hard thing all around.
Yes.
Um, and so I think that is where having a good supervisor is so important, because I think it's that supervisor's job, it's that BCBA's job, if this is like an RBT or a BT who's working with the individual, to talk to them and kind of meet with them after and debrief about that situation and say, okay, what happened? What can we do to help both you implement this intervention and to, did some what went wrong, and kind of work through that after the fact. And also, I think if someone is coming to you and saying, hey, why don't we switch out? Or I think you need to take a break. It's not, I think we have to remember it's not anything about us. It's about the situation that's currently happening. And usually, somebody outside of that situation is going to have a much clearer take on what's going on because they're not
Yes.
emotionally invested in it at that point. And listen to them, because they're not doing it to, you know, be mean or belittle you and say you can't run this intervention, you're not a good staff person. And also that you're not a good person working with this client. They're It's just not a good situation in that time. And I think actually listening to that individual, whoever it is, and taking that time, and even, you know what, you could take a 5-minute break. Maybe that situation is still happening and you can step back in. It's always good to have kind of this contingency plan of, okay, if it goes X amount of time, then we're going to switch out and then the other person's going to take over for a little while, and maybe planning ahead like that so it doesn't seem like such a problem in the immediate moment.
Yes, I think that makes so much sense. I think also within an organization this approach is welcomed and supported,
Hmm.
then you are most likely going to be stepping in for someone else, right?
Right.
That swapping is happening, and then it's really all about sharing the responsibility, right? And
Exactly.
working together to support the students, you know, through the good times and the really hard times.
Yeah.
And so after you've had a day like that, do you have any things that you do sort of to, or that you did when you were young, a young professional, to help you kind of debrief, kind of deal with it, take a deep breath,
Mhm.
recharge, and rejuvenate to go back the next day?
Having someone to talk to about it is really important. So even it might be with your coworkers and kind of saying, what happened today?
Mm.
Today was not a good day. And it's okay to say that. In in today's, I mean, when I first started working, social media was so not a huge thing. So we do need to be careful because I know sometimes people post about things or they talk about the services that they provide, and so we have to be super careful about what we're posting. But even if it's just at the end of the day with the people that were in that situation with you, and just kind of going, we need to talk about this. Um, I think that was always helpful, especially because there were there were some situations that looking back on it ended up being pretty funny, not in the moment, but you look back and you're like, if I told anybody what happened, they wouldn't believe me.
Right.
Um, so having people to kind of, and again, this keeps going back to working with good people and having a good team. Because a lot of the stuff that happens, you can't talk about outside of that building.
Right.
So finding ways that you can talk about it is really important. And maybe even if you have maybe like some people like journaling, if there's a way that you can maintain confidentiality but get your feelings out about it. um, you know I some people work out and they need to like expel that energy, and whatever ways that you find you can take care of yourself, that is so important, whether it's just like watching trash TV and eating junk food or listening to music or reading or whatever it is. You have to find that thing that helps you, and it might change. You might find that something helps and then after a while it doesn't, and then you have to figure out what else is going to help you.
Yes, absolutely. I learned from Dr. Page Rates about joyful jolts, and looking up kind of pictures of your dogs or something cool that you made, baking recently, or of your
Mhm.
kids, or of a sunset or of the beach you went to at some point throughout the day. Especially when you're taking that break, or if you're taking that break and you need to just kind of like take a minute, and looking up a joyful jolt, I think can help, is one of the things I've learned from her as
Mhm.
well, in addition to what you're describing. And then I think about also kind of from a leadership perspective, right? Where I think it require that environment of supporting one another
Right.
really starts at the top. And so, really creating that kind of environment um, is important.
It is, because it's one thing for any direct support staff. They're kind of all in this situation together, usually as the people who are interacting directly with the students or with the clients. Um, but the people, the BCBAs, the supervisors, um, if there's a director, whoever it is, they also need to recognize that as well, because then they need to support if somebody needs to leave, like if they just have an awful, awful situation happen, and the director needs to recognize this person might need to leave like 15 minutes early and just get out of here, or something happens and they need to
Yeah.
leave for the rest of the day. um, that those things are okay, because if you are not supporting your staff, then they're going to leave. And
Yes.
so many agencies have such a high rate of turnover for a variety of reasons, not specifically this reason. But staff retention is so important for the clients, for the students, for even financially for agencies. And so it really is in the administration or whoever is kind of on top, it's in their best interest to provide these environments, because that way their staff are supported. And if the staff are supported and know what they're supposed to do and have that training, then those clients are going to make the progress that everybody wants them to make and they want to make for themselves.
Absolutely, absolutely. It's a all hands on deck, creating
Mhm.
that learning environment that supports the development of so many different skills. And when you're talking about people who have complex profiles and have
Mhm.
comorbidities, it really requires a lot of people in the room to think
It
through
does.
what's happening and why, and connecting those dots. Um, can you talk about a little bit about your approach that perhaps you're going to be talking about in your talk and your presentation coming up on February 6th, about connecting those dots.
Yeah. So, one of the things, and I will absolutely admit, I didn't have a full appreciation for this until much later in my career, as so many things happen that way. Um, but we are really good at looking at the contingencies around behavior and using our functional analyses and all of our other assessments and tools to understand behavior, and we look at the environment. And I think we understand the role of covert behaviors and private events um, and all of those kind of biological factors, but it's really hard to take those into consideration when we are conducting our assessments and we're developing behavior plans, um, because we don't have access to them a lot of the times. And even if they are happening, if we don't have clients who can verbalize that and tell us what's happening, then we still likely don't have any access. So, what I want to talk about is, or what I'm going to be talking about, is a way for us to conceptualize this and to start thinking of how we can take those things into consideration, even if we can't necessarily access them. Diagnosing a lot of comorbidities for neurodivergent individuals is really, really difficult because there's a lot of overlap in
Yes.
behaviors and symptoms, and it's hard to tell, is this because they are autistic? Is this because they have anxiety? Is it a combination of both? Um, and so one of the things I really like when I'm talking to students about this and you know thinking about this is, how do we combine our understanding of responding conditioning with with what we know about operant
Right.
conditioning and our understanding of operant conditioning? Because if we're not taking those biological reflexive behaviors into consideration, we are discounting a huge portion of what is going on. And so we might be able to put an intervention in place based on our assessments, and we might have done a really good job on that assessment. But if we're not considering some of those biological or covert behaviors, then we're not necessarily going to get the full effectiveness of what we can do.
Absolutely. And I'm so happy you mentioned respondent conditioning, because I feel like that um, paradigm, that understanding, that concept that we have in behavior analysis is really underutilized in understanding
It's
behavior,
so underutilized.
right? Like, I think it explains so much of our responding, and then thinking about also the connection between respondent and operant behavior, right? And
Right.
respondent operant conditioning, and how those are really inter intertwined. So much
Hmm.
so that sometimes I'll talk with students about situations and I have a hard time pulling it apart because it
It is.
becomes,
It's
right?
so intricate.
It is so intricate, and like that's how it is. and
Hmm.
and I think you, when you use the word wonderful. I think there's that appreciation, or we should have that appreciation
We
for
should,
that
yeah.
level of complexity.
Hmm. And I think that also helps to address some of the criticisms our field has faced
Yes.
in recent years, where we're not considering these biological factors. And not to say that we never have, we definitely have, but I think it's buried a lot.
Yes.
And also the people's thoughts and feelings. If someone is having really intrusive, perseverative thoughts, we're not going to see that, but it's a huge factor in a lot
Yes.
of their overt behavior. And so, even if we don't have access to it, it doesn't mean we shouldn't be considering those things.
Yes. Oh my gosh, absolutely. And when you think about all of this complex behavior, and think about people who have multiple diagnoses, and there's a good percentage of them who have two,
Yeah.
three, four, across psychological, medical,
Hmm.
developmental diagnoses. Can you talk about the role of collaboration in providing sort of that full support that these individuals so desperately need?
We are, as the BCBAs or behavior analysts, we are a small part in such a bigger team that these individuals need. Um, and so I think a lot of humility about what our role is and what we're able to do is really important, because we might be able to address or we are able to address the environmental contingencies that are controlling, especially the overt behaviors, but we work with other professionals that have a better understanding of neurobiology, and if they have a medical diagnosis, how that medical diagnosis works. And that means that we might not be the primary person intervening on this individual's behavior. We might be the secondary or tertiary person as part of this team. So having a clear understanding of everybody's roles and where everybody is going to come in is is so important. And I think I gained a real appreciation for that, because we would have these large meetings with the psychiatrist who saw a lot of the students and clients that I worked with, and it was such a collaborative process that I got to see what something like that should look like. So the psychiatrist would say, okay, let me look at your behavior data. Let me see what's going on. I see that we changed this medication on this date, but we have seen a decrease in behavior. Did you implement a new intervention? Did you change something? And we would really comb through the behavior data, looking at it from both that medical perspective, as well as the behavioral perspective. And that really helped a lot of our clients. Like, if someone had a medication added, I can go in and say, yes, the behaviors have decreased, but they're also falling asleep during class. And work directly with the psychiatrist that way. And the teachers were present, the clinical director was present, the OT, PT, SLP would sometimes attend these depending on the client. And everybody, just getting everybody in a room talking and understanding that one person's role was not more important than another person's role was essential.
Absolutely, 100%. And I think you're right that it does require a level of humility that, we know what we know, and we honestly don't know what we don't know. And all of
Mhm.
these people in this room have so much value. And I love personally hearing other people's perspectives based on their level of expertise
Yes.
that is not mine. And for me, that adds so much value and richness to understanding and supporting these individuals.
One of the things that I think really broadened my take, after I graduated from my master's program and got my BCBA, was that my direct supervisor at the time was first trained as a licensed clinical psychologist and then later on got their BCBA. So some of the best conversations that I've had in my, because you graduate and you're like, okay, I got this, and then you forget that passing the exam is like the minimum requirement
For
for being
sure.
a BCBA, and there's still so much to learn. Um, that we would talk about a case, and my supervisor would come at it from the clinical perspective, and then I would come at it from the behavioral perspective, and we would say, okay, well, what's the best way to address what we're seeing with this individual?
Yes. Yes, I love that. I love that combination. I think if I were to go back and do it all over again, that's what I would do. I would get my clinical psych degree
Mhm.
with a specialty in behavior analysis, but it was so long ago that it really wasn't an option,
No,
and
it wasn't.
it just wasn't, there were only a few master's programs in ABA. There was no doctoral program.
Mhm.
It was, we didn't have all of the paradigms we have now to understand behavior. And so I don't know, I feel like, I'm sure you feel the same way. Like I've grown and learned and continue to learn. That really enhances my understanding and practice of behavior analysis.
It does. And attending things or finding ways to get information about those other areas.
Yes.
So
Yes.
you're not going to be the expert ever in those areas unless
Right.
you get that additional training and supervision and all of that. But
Right.
if you are going to be working collaboratively, you at least need to know what's going on. And that's going to be a little bit of my talk as well, some recommendations around that.
Amazing. Amazing. So you've given us a little bit of teasers about what to expect. Is there anything else we should look forward to?
Um, I love examples of things that I know they help me learn and understand. So the majority, I think, of the presentation, I have to go back and check the slides and the timing and all of that. Um, but it's going to be looking at case studies.
Oh,
Um,
awesome.
and unfortunately, because of like client confidentiality and things like that, I don't have the actual data because I'm not allowed to present that. Um, but the case studies that I'll be going through are based on individuals that I've worked with. And so obviously everything has changed to maintain that confidentiality, but the core of it is still there. Because I think, we can talk about the importance of understanding, the combination of respondent and operant conditioning and show slides and all of that. But going step by step through how you can do this is, I I think, is the more helpful way to go about it. And
Yes.
at least for me, it would be. And so I designed it around the way that I think it's best to kind of talk about it in how I would want to hear that information.
Yes. Amazing. Amazing. I can't wait. And lastly, what would you tell your younger behavior analyst self?
First and foremost, I would tell my younger self to have more humility. Um, to I think about some of the things that I said, or and not meaning to be kind of stuck up about it, but just I I think a little bit is that that's how the training went back then. Um,
Yes.
and take a step back and say you need to stop and you need to listen to these other people. And that is something that I really impress on my students, especially my grad students who are about to go out into the field and get their BCBAs, is that this is the first step. Getting your degree, sitting for the exam, passing the exam is step number 1. And you are going to need supervision and you're going to need mentorship for several years after you graduate, and probably every time you make some sort of change in what you're doing. Um, you know, say you work in a place for 10 years and then you decide to change careers or change what you're doing or change populations, you're still going to need someone to help you make that transition, because I think, as you said earlier, you never know what you don't know. And everybody comes from a different background and perspective and has something to teach. We don't know everything.
Absolutely. And I think that that mentorship is so important throughout our careers,
It
particularly
is.
when we're young. But as you're saying, if
Mhm.
we shift out to a different focus, we change focus, or we have an individual that we're supporting with a really complex profile with
Yeah.
comorbidities that are in there, and learning histories and all of the things, and maybe family variables, and just so many things that we have to think about, that we need to reach out to people and say, hey, have you
Hmm.
supported someone like this? Tell me what you learned. Tell me what I
Yeah.
should think about. I still do that to this day, is
Oh,
after
I do as
25 plus
well.
years, right? Like,
I have
those
my
people,
go-to people. I'm like,
right?
we're gonna have a phone call. We're gonna meet. We're gonna talk. And I think another thing too is building those networks of people that
Yes.
you can reach out to, whether it's through your grad programs, networking and building those connections while you're in your programs is so important, because
Yes.
not only are those people going to be people who understand what you're going through in that minute, because everybody in that group knows the stress of the classes and the supervision and all of that. But those are people who you can reach back out to throughout your career potentially.
Yes.
And then also making use of your professional organizations and getting involved with those, and that's another great way to build those networks, so that when you do have questions, or when you need some advice, or you just need someone to talk to about a situation, you have that and you don't feel so isolated. Because I think especially in states or in areas where the population of BCBAs is really low, it can get very isolating. And so that's an while social media definitely has some issues around it, it also has a lot of benefits in connecting people and helping
Yes.
to build those connections and networks so we're not so isolated.
Absolutely. And building community is something that's really important to me. And for me, the CE program and doing these podcasts, so people can learn about what other people are doing and
Yeah,
think about, Dr. Markovits when they have a really complex case and watching the on demand CE event or reaching out to you or listening to your podcast to get that kind of support and that kind of community with people who are all over the country and all over the world. And I
right.
love that because it creates these rich connections and
Mhm.
conversations and sharing about what we're doing and learning as we go. And in a field where it's hard,
It is.
it's challenging. It can be emotional at times. It can be draining at times. And so the more that we connect and share, um, I think the better we will be and the more we can build that resilience and really truly stay in it and find that fulfillment for the long haul.
Yeah,
So thank
definitely.
you so much for being here today. I am
Thank you for
so
having me.
yeah, I'm excited to hear more and reviewing case studies. I think everyone really appreciates that. So I'm very much looking forward to that. It's on February 6th at 12 o'clock from 12 to 1:30 Eastern Time. If you miss it, no worries. You can always watch it and earn CEUs on demand. Thank you so much. This has been Behind the ABA Talk podcast with Dr. Rebecca Markovits. Thank you so much for sharing your expertise. And if you want to learn more about the CE event, you can go to www.LSGurdinConsulting.com and check out the on demand library. And we've just launched RBT modules that are happening monthly. The first one was yesterday. They're also offered live and on demand. So be sure to check it out. And thank you again to our CE partners and sponsors, Massachusetts Partnership for Youth, Lab Collaborative, Accept Collaborative, and QBS Safety Care. And a special thank you to my podcast producer, Cole Asher Selznick. And we'll see you all next time. Take care.